fluoride, mechanism of prevention of dental cavities. Now let's come to, there is a LR shunt mechanism. The LR shunt is Luebering Rapoport Shunt, and this happens in the red blood cells. Okay. First thing to remember in this slide is the title. Title itself can be a question. If the question is made, okay, where is this shunt going on? Which cell? Red blood cells called erythrocytes. Erythrocytes are red blood cells. What is Luebering Rapoport Shunt? So, as the name says, shunting, you are diverting a glycolytic pathway into some other direction. Okay, that's what is shunting. Okay, so let's see how it happens. So let's focus on the figure and then I'll come to the left side of that, the theory part. Glucose making glyceroldiate 3-phosphate. We've seen that. And then making 1,3-bisphosphoglycerate. And that 1,3-bisphosphoglycerate goes to 3-phosphoglycerate and then phosphoenol pyruvate and all that. We have seen that, right? So when 1,3-bisphosphoglycerate is converted to 3-phosphoglycerate, that's a substrate level phosphorylation where you can see ADP enters and ATP comes out by phosphoglycerate kinase. That's how ATPs were made in the red blood cells. One of the 2 ATPs you get from each molecule of glucose there, right? Now, the shunting mechanism, the other direction that it is going, as you see in the green arrows there, this side of the reaction. This 1,3-bisphosphoglycerate is kind of diverted into a molecule called 2,3-bisphosphoglycerate. And simply we write it as 2,3-BPG. Whenever you come across this term, 2,3-BPG, it is 2,3-bisphosphoglycerate. Why this 2,3-BPG is important for you? It is important for you here in biochemistry, later in physiology, later in pathology. Because whenever you see anemia cases, generally in anemia, there will be rise in 2,3-BPG. Remember this. Okay, I will explain you why. What is the role of this 2,3-BPG? And that 2,3-BPG, which is coming from Luebering Rapoport Shunt, especially in the red blood cells. Okay, so 1,3-bisphosphoglycerate is diverted into 2,3-bisphosphoglycerate by an enzyme called bisphosphoglycerate mutase. Bisphosphoglycerate mutase. Because what is mutase enzyme? Mutase enzymes, they belong to isomerase class. They simply alter the position of atoms. So what it is doing here? The first carbon phosphate is changed to second carbon. That's why 1,3 becomes 2,3, right? Anyway, so this bisphosphoglycerate mutase is positively modulated by ATP. Please write this down. Positive modulator of bisphosphoglycerate mutase in the red blood cell. It is all in the red blood cell. Don't forget that. See, I bolded it. No other cell, only in the red blood cells. Whenever red blood cell has high concentration of ATP, means when red blood cell has sufficient ATP, where it need not worry about ATP. At that time, what red blood cells will do, they are going to divert about 25% of their 1,3-bisphosphoglycerate into this 2,3-bisphosphoglycerate side. It's kind of they shunt it out. How much percent? Only 25%. Not like everything is shunted. Because if everything is shunted, then it won't get ATPs. It got to be, red blood cell has to be careful about how it spends ATP, right? And how to conserve those ATPs. It's like dollars, as I said yesterday. You got to be careful. Red blood cell is careful. When it is making 2,3-bisphosphoglycerate, it is making sure it does it only when there is sufficient ATP. That's the first thing. That is why ATP itself is a positive modulator of that enzyme, bisphosphoglycerate mutase. That means only when there is sufficient ATP, it will go and bind to that enzyme and activate the enzyme. At that time, what that enzyme do? It takes 1,3-bisphosphoglycerate to 2,3-bisphosphoglycerate and store it, make it, stock, keep it. Okay. And so this is the condition where this happens. The condition is in the red blood cell. Other is at times of excess energy. At times of excess energy means what? When it has more ATPs, right? Let me write that as well. You can also write it down. At times of excess energy means whenever there is increase in ATPs. That's what it means. Whenever there is increase in ATP, at that time 25% is diverted. Now let's see what is the function of 2,3-BPG. Why a red blood cell is so worried about making 2,3-BPG? 2,3-BPG, it will go and bind to hemoglobin subunits in the red blood cell. Because what is the function of red blood cell? Red blood cell has got hemoglobin. They go to lungs, load with oxygen. They come to the peripheral tissues, unload the oxygen. That's what they do. That's what their function. Hemoglobin carrying oxygen from lungs to the peripheral tissue, right? So when hemoglobin is, means when the red blood cell is there in the lungs carrying that hemoglobin, in the lungs we have a partial pressure of oxygen like 95 to 100 millimeter of mercury, something like that, and we are loading oxygen to hemoglobin. All 4 subunits are loaded with oxygen, 100% saturation, and then they will return. As they return, they need to unload. They have to give that oxygen to the tissues. That is their job. They have to give. They need to unload. What if they don't unload? So, no oxygen to the tissues. If the red blood cell decides, no, I'm not going to give. So, what happens to the peripheral tissue? Your electron transport chain decreases. So, the function of red blood cell is to carry oxygen from the lungs and unload it in the peripheral tissue. So there are some factors which will help in unloading of oxygen from hemoglobin in the peripheral tissue. And one of that factor is presence of 2,3-BPG. Red blood cell, if it has sufficient 2,3-BPG, it is able to effectively unload oxygen, efficiently unload oxygen in the peripheral tissue. So once the oxygen is loaded at high partial pressure, when it comes to the peripheral tissue where the partial pressure is lower, like 40 millimeter of mercury, it will go and bind to the hemoglobin and kick out oxygen. And thereby oxygen gets into the tissues. If you ask me, okay, so red blood cell had that 2,3-BPG inside even when it was there in the lungs, why did it not allow oxygen to bind? Means why it is allowing oxygen to bind, why it is not unloading there? Not sure if you are getting my question. You know, you have red blood cell. Within the red blood cell, you have 2,3-BPG. It is there always. Whether your red blood cell is there in the peripheral tissue, your red blood cell is going to the lungs, it is there. Even in 2,3-BP is there in the red blood cell when it was there in the lungs also. But when it is there in the lungs, 2,3-BPG is not unloading oxygen. Why? The reason for that is partial pressure. What is the partial pressure of oxygen in the lungs, in the alveoli? It is nearing 100 millimeter of mercury, high partial pressure in the lungs, because I inhaled a lot of oxygen, right? So it is there in the alveoli, and a lot of partial pressure of oxygen in the alveoli. At that high partial pressure, 2,3-BPG do not have any effect on the hemoglobin. It just stays neutral there. When it comes to the peripheral tissue, say my calf muscle, right? Partial pressure is 40 millimeter of mercury, lower partial pressure. At that time, 2,3-BPG gets start its job. What it does? It will go and bind to hemoglobin and kick out oxygen from hemoglobin. Oxygen enters into mitochondria for electron transport chain. And this is why we need this 2,3-BPG to effectively unload oxygen. When the hemoglobin is unloading oxygen, the hemoglobin also has got a sigmoidal curve, like your allosteric enzyme. So it is going to shift the sigmoidal curve to the right side of it. Right shift in the sigmoidal curve. Right shift in the sigmoidal curve means what will happen to the affinity of your hemoglobin for oxygen? Decreases. Always remember, right shift means affinity decrease. Why? Because Km increases. Right shift means, if you didn't get the concept, I want you to know this. Let me write down, although it will take a couple of minutes from my teaching. but still it is worth it. You got to know. Okay, so right shift means decrease in the affinity. I'm going to write this particular. Let's consider this one. This is your sigmoidal curve. Okay, so and x-axis is substrate concentration, as you know already. Now, if I take, and this is the maximum velocity, that this is Vmax. How do you take half of the means? How do you find out the Km? You take half of the Vmax, right? I'm going to point this. This is my half Vmax, and then what you do? You just bring this point, interpolate with this curve, and bring it down here, and this is the Km of your whatever it is. That's what it is, right? That's how you find out Km. What is Km? Km is the substrate concentration, that is the substrate concentration at which your enzyme or any molecule reaches half of its max, right? So we have found out Km now. Let's consider that is Km number 1. I'll write Km1. Now, I am going to draw another curve, reaction velocity curve, which is kind of right shifted, right shift. And then let's find out the Km for this particular reaction. So same Vmax, almost reaching same there. So I will have point here. And then I'm going to do the same thing, bring this line and put it here. This will be Km2. So which Km has got a higher value, Km1 or Km2? Km2. Higher the Km means lower the affinity. If you apply this to hemoglobin now, if the hemoglobin reaction velocity curve, if it is shift to the right side, always that means there is increase in the Km. Increase in the Km means decrease in the affinity. So in the presence of 2,3-BPG, the sigmoidal curve of hemoglobin, oxygen dissociation curve, is shifted to the right. That means it is decreasing its affinity for oxygen. Decreasing affinity for oxygen means what? It is no longer holding to oxygen, it is simply releasing it. And that is the mechanism. That's what 2,3-BPG does, and you should be able to identify this. Why I am saying this to you is, in anemias, in certain anemias, which we are going to discuss, there is increase in 2,3-BPG. And whenever there is increase in 2,3-BPG, what will happen to your oxygen dissociation curve? Right shift. So in the STEM, sometimes they don't write that there is increase in 2,3-BPG. But they will explain this patient has anemia and all that kind of thing, like signs and symptoms given, but they don't write this patient has shown increase in 2,3-BPG. But what they will write is, they will show this patient has shown the significant right deviation or right shift in the oxygen dissociation curve. Write it like that. Or show the curve. This is what is the observation in this patient. There is a right shift. So whenever you see right shift in the oxygen dissociation curve, one of the factor that does is 2,3-BPG. Okay, that's why you need that information. Okay, so what are the conditions for right shift in oxygen dissociation curve? What condition causes right shift in the oxygen dissociation curve? Make sure you remember this, important, because each one of them can be the case stem. Can use each scenario to make a case stem, right? If a patient is living, not patient, if a person is living in high altitude, high altitude, as you go up from the sea level, what happens to the oxygen concentration in the air? Becomes decrease, thin air. As you go up, air becomes thin. That means less oxygen. So example, if you go to 18,000 feet, 18,000 feet above the sea level, like say go to Himalayas, Nepal, or go to Peru. Peru. How many of you went to Peru? See, nice place. At some point in time, all of you go there. It's nice, very nice, actually. Don't miss, what is that, Rainbow Mountain. Beautiful. Don't miss that. And you go on top of that, the highest point. That is 17,400 feet or something. Fantastic experience. When you get a chance, do it. Okay, so if you go that high, right, and when you return back, some of you may feel little bit of headache, little bit of nausea, kind of vomiting sensation. I did feel that as well, because the air is so thin. So at that time, what happens? If people were living there, like people like you and me, Caribbean, living at the sea level, so no problem. But when we suddenly go there, it takes time for us to get used to it. That's a acclimatization thing, right? People who are already living there, so they don't feel anything. Why? Because physiologically, they will have high levels of 2,3 BPG in their red blood cell. And what this 2,3 BPG does, it is efficiently unloading oxygen. Whatever the little oxygen that in red blood cell is bringing from the lungs to the peripheral tissue, it is efficiently unloaded. Whereas in you and me, out of 4 oxygen molecules that our red blood cell will bring from lungs to the peripheral tissue, only 2 of them are released. Only 2, 50% unloading in you and me. That's the fact. Whereas in them, when it is loaded, maybe only 3 sites are loaded, or maybe 2 sites are loaded, not full. But whatever is loaded, it has to be unloaded. So that's how presence of 2,3 BPG makes a difference. So people living in high altitude, they will have higher concentration of 2,3 BPG. And people who have chronic lung conditions, like chronic obstructive pulmonary disorder, COPD, so that means they won't be able to fill the air properly, right? Like they don't inhale, that the capacity, vital capacity is down. So they won't be inhale like you and me. So that means they won't be able to load sufficient oxygen onto the hemoglobin. So eventually what they do, they will develop more 2,3 BPG in their red blood cell as a compensatory mechanism. And that's why people with lung conditions like air obstructions, eventually they will have more 2,3 BPG as a compensation. Even congestive heart failure patients, because their heart is not pumping properly, eventually it will affect their lungs, and then over a period of time, they will have increased 2,3 BPG in the red blood cells. Tissue hypoxia, if it is chronic, there will be more 2,3 BPG. Pyruvate kinase deficiency, see, especially I have written this. Pyruvate kinase deficiency leads to hemolytic anemia. We are going to discuss that. In that condition also, there is increase in 2,3 BPG. Okay, so these are some of the conditions that you must remember to answer question related to 2,3 BPG. Important. Okay, so that's about Luebering Rapoport Shunt in red blood cells.